Hi everyone, this is Dr. DeFilippi. Welcome, bienvenidos a todos. And today we will be talking about poisonous plants that you might encounter in an emergency room setting or situation. So, we will be taking a botanical and toxicological review of some of the most commonly seen or most deadly poisons that you may in some way or other encounter in your professional career in the emergency room. So, there's a lot of information in this module, firstly. The reason is I don't really have a book for you guys or a reference guide. So the best way for me to put together is to make sure you have all of the information so you can use this as a reference going forward in your API rotations, in your future endeavors. Hopefully it's a useful reference guide. That being said, I want to tell you exactly what to best focus on in this module. Number one, you're going to want to learn both the common and the Latin name of the plant or fungus, the Latin being the scientific name of the plant. Now, even in different languages, the Latin or scientific names of plants and fungi will stay the same. So if you have a dietary supplement or some sort of herbal medicine, and even if it's written in, say, like Japanese or Chinese, they're going to write that Latin name out on the ingredient list, if there is indeed an ingredient list, but it's not going to change the same as change between different languages. Black cohosh, Actea racemosa, is going to be Actea racemosa wherever in the globe you find that supplement. So that's why people always complain, like, "Oh, Dr. DeFilippi, why do you make us learn the Latin names of it?" And I just say, look, it's your key. It's just like learning a brand or generic drug. Moreover, you're going to want to take note of the active ingredient, or in this case, the most active toxin of each plant, which contributes towards its mechanism of action, which causes toxicity in this matter. The active ingredient is always a phytochemical. A phytochemical simply means it is a chemical naturally produced within a plant. Phyto meaning plant. You will find the toxidrome, or sort of appearance or grouping of symptoms, which is associated most with each exposure. And that includes the symptoms that are characteristic of each toxidrome. So this is quite useful if you don't know, if you're not familiar with the plant, for instance, but you know that the plant is within the cardiotoxic toxidrome of symptoms, you may have a better idea of how to treat that patient. Also, I make sure to highlight any unique or identifying factors which indicates poisoning from a toxic plant or fungus. This would be what sets one of these poisons, even within the same toxidrome, apart from another poison within its same toxidrome. Because although the toxidromes are grouped together by symptoms which are shared, sometimes there are little quirks between different types of poisoning which you need to recall in order to deliver the best care to the patient. Also, broadly, anything else in bold is something that I think you should at least consider, take some notes on, and be ready to respond on a quiz to. So let's begin. Natural products are secondary metabolites. Well, you're probably wondering, well, what are primary metabolites? Primary metabolites are exactly what you would think. They are chemicals, compounds within nature, broadly within nature, which contribute to the basic nutrition of an organism and the basic homeostatic functioning of that organism. That could be something as simple as sugars and carbohydrates, as proteins, as starches. Certain amino acids can also be considered as primary metabolites. Secondary metabolites provide some sort of benefit beyond basic nutrition to an organism. These are chemicals naturally produced within plants and other organisms which possess highly complex and varied chemical structures. They give the organism a competitive advantage in some way. So I like to say, basically all plants except for tumbleweeds cannot run away from danger. Plants can't run away from danger. If something wants to eat them, it's going to eat them. However, what do they have to do if they can't run away? They have to broadly use secondary metabolites to fulfill the three following categories. They'll either use them for defense, they will use them for attraction, or they will use them to adapt to environmental stress. Let's start off with adaptation to environmental stress. These beautiful flowers right here are crocuses. They are the first flowers that bloom usually in early spring. And by being the first flowers to bloom, they get a competitive advantage over their peers, right? Because they get pollinated first. They're going to be spread around by whatever other organisms interact with them. And they're not going to be competing for light to photosynthesize from any trees because most of the trees won't even have their leaves yet. Now, how are crocuses able to do this to outcompete? They produce basically a natural secondary metabolite which acts as an antifreeze. Yes, crocus come with built-in antifreeze. And this antifreeze is naturally produced within the vasculature of the plant, which prevents it from dying off if it experiences a frost on an early spring day, or indeed if it snows one night and the crocus still has to peek its way out of the snow. The crocus is perfectly fine because it's not going to freeze and it's not going to be damaged by those very cold temperatures, which could kill any other plant. Therefore, it produces a competitive advantage for adaptation to environmental stress, and the crocus thrives in the early spring. On the other flip side of this, cactus and other succulents often have adaptations to UV light and very dry temperatures that are also secondary metabolites. I like to say the cactuses basically produce their own sunscreen that keeps them from being burnt to a crisp under the hot Arizona sun, for instance. The secondary metabolites, however, that we're mainly going to be talking about in this course are ones related to defense. These are anti-fetants, such as toxins or naturally produced insecticides. So if the plant can't run away from danger, the very least it can do is make whatever is trying to eat it either very sick or make themselves taste so bad that the predators know to avoid the plant entirely. These can also include antibacterials and naturally occurring antifungals, because of course fungi and bacteria can also infect plants. And it might also be compounds which inhibit the growth or germination of competing plants around it. A very good example of this is the walnut tree. Walnut trees, their roots, as they spread out into the ground, their roots actually secrete a secondary metabolite, which poisons the ground around it, which prevents anything else from growing in and around the walnut tree and allows the walnut tree to grow up big and tall without any competition in its immediate area. Secondary metabolites, of course, can also be used for attraction. This is why flowers smell so nice, right? Or why they have these beautiful pigments and pretty colors. It's to attract pollinators and other seed dispersing animals. So it is a little paradoxical, isn't it? Where, yes, some plants might produce these very, very potent chemicals and toxins for defense, while at the same time creating fruit that are intended to be eaten by animals so the plant can actually propagate. So it all depends. Now, in terms of some epidemiology and statistics, let's talk about plant poisonings as reported by the poison control centers across the country. Well, we know that the poison control centers across the United States, across the 50 states and territories, receive around 50,000 calls per year related to plant exposures. Now, the vast majority of these, around 80%, are just phone calls about plant exposures or ingestions reported in children, mostly non-lethal plant ingestions. These are just kids who maybe they find they're 2 or 3 years old, they're toddling around, and they might stick a few leaves or a flower into their mouth. And the parents, rightly so, out of an abundance of caution, are going to make sure, calling poison control to make sure that they don't have to do anything. Household and garden plant ingestion is the most common, of course, within this category, and the large, vast majority, the super majority, if you will, these are thankfully calls that either didn't have to be made or that can be easily remedied by a quick trip to the ER. Of the remaining 20%, we have 3 main categories. Experimentation, especially with hallucinogenic plants and substances. This shows up a lot in adolescent and young adult statistics in terms of plant poisonings and calls which the Poison Control Center receives. They may also get calls from trekkers or foragers who are foraging in the wilderness to make their own, to get their own food or whether they're hiking, if they just want to have a more naturalistic approach to their diet, or maybe a weed just snuck into a garden at the wrong time. Many poisonous plants look a lot like edible plants. And if people make that mistake, they call poison control. And unfortunately, one of the other statistics that we do have to talk about are attempts at self-harm and suicide. These are often with an intentional ingestion of a large amount of plant material. And we do get calls to poison control regarding how to best treat attempts at taking one's life. The majority of moderate to severe outcomes of plant poisonings are usually due to recreational use or suicide attempts. However, the good news is death resulting from plant poisoning is exceedingly rare in the United States. So between 1983 and 2009, there were only 45 cases of fatal plant poisonings in the US that were documented and that could be actively traced to poisonous plants, which is a really good statistic. That being said, people can still get very severely ill from plants, but the chance of dying is still relatively quite low. One of the reasons why we have some issues treating plant poisoning, specifically in an emergency room setting, is that most people just aren't that knowledgeable of different plants that are poisonous and just what they look like in general. There's very few studies, and in fact, the one study I could really find that actually looked at the identification skills of healthcare providers within the emergency room was from all the way back in 1988. So this is with the caveat, they didn't have Google back then, but they did have reference books and things that they could look up. The study from 1988 among emergency department staff reported that 87% of them failed to identify poisonous plants versus non-toxic plants when they were paired up with each other. And this was 87% of them failing to do this most of the time. I mean, that's worse than a 50-50 guess, isn't it? We've gotten better since then. Google and plant identification apps have helped, but again, most ER workers do not receive formal training in plant or fungus identification. And indeed, this is reflected in America's Poison Control Center's data. That's the National Organization for Poison Control Centers across the US. The most common plant exposures are exposures to unknown, unspecified, or unidentified plants, accounting for about 12.2% of reported cases of plant poisoning. So it's still a common problem today where we cannot identify these potentially dangerous ingested plant toxins. Furthermore, there's really no clear or standardized classification system for the type of plant poisonings and related treatments to them. It often requires that the plant is identified first. We just established that doesn't always happen. If you are able to identify the plant, or say the patient brings the plant in with them to the emergency room, you have to do some research. You kind of have to do a deep dive into research. You have to classify the plant via its chemical compounds and pharmacognosy, or the study of the medicine from natural sources, which might historically come from the plant. And even then, there's not a ton of resources out there to access that, aside from maybe Natural Medicine's database. All in all, it is a complex, confusing, and often time-consuming use of algorithms which might delay the appropriate care, especially if the plant is highly toxic and it's a potentially lethal or dangerous situation for the patient. So what do we do when there's no standardized or classification system? We try and come up with a solution, which in this case is rapid toxidromic classification. So broadly, a toxidrome is a gathering or a curation of all sorts of different symptoms which are associated with a poisoning of a specific type. There are many different toxidromes. There are many ways to break it down. The one that I'm covering today breaks down all plant poisonings into 4 different categories. So all plant poisonings can be related to one of these 4 toxidromes. It can be the cardiotoxic toxidrome, the neurotoxic toxidrome, the cytotoxic toxidrome, and the gastrointestinal or hepatotoxic toxidrome. So as we go through, I'm going to give you highlights of plants which fit each of those toxidromes, and we're going to see how we best treat them. So let's start off with the cardiotoxic toxidrome. The toxidrome, in which the toxicity most affects the heart. Our common plants, our worst offenders in this category are foxglove, oleander, and wolfsbane, otherwise known as monkshood. Again, this is one of those important reasons why we want to know the Latin name, right? Because it might be called two different things, but the Latin name will always stay the same. Symptoms of cardiotoxic toxidromic poisoning include initial nausea, vomiting, and abdominal pain. Usually it is followed by hypotension, a decrease in blood pressure, hyperkalemia, where your potassium is increased. This increase in potassium is often a precursor to AV or atrioventricular block and ventricular arrhythmias, these irregular beatings of the heart, and the eventual cardiovascular collapse if the poisoning is not treated. General treatment of the cardiotoxic toxidrome. We are very lucky in this toxidrome to have reversal agents available. That is assuming that it is a reversal agent which is appropriate for the type of plant, because not all reversal agents work on all plants within this toxidrome. But broadly, we would treat cardiotoxicity with atropine to increase the heart rate, as well as vasopressor support to increase blood pressure and blood flow to the coronary arteries, as well as increasing hemodynamic stability. We want the heart to be stable, to be fueled despite this toxicity which is occurring, and we want to most importantly get it beating in a more regular way. So let's begin. Foxglove, or Digitalis purpurea. It is a flowering shrubby herb, which is a very popular ornamental flower throughout the US. They vary in color, but you generally see them in like pink or purple. And the problem is when they're not flowering, they are easily confused with other plants. They don't look like flowers when they're not flowering. Surprise, surprise. They actually look a lot like plantains. So sometimes people, if they're gardening things and something gets crossed with another, or they're not paying attention, they incorrectly harvest some plants from the foxglove plant, put it in their salad, and then bam, they're in VTAC. It can be quite an issue. Why? Because foxglove naturally produces digoxin, which is a cardiac glycoside. We know it's an antiarrhythmic medication as well. However, as a prescription medication, it has a very narrow therapeutic index. It's an NTI drug, meaning it has to be dosed very, very carefully to avoid toxicity. Also, furthermore, consumption of any parts of the plant may lead to toxicity. So it doesn't matter if you're consuming the flower, the roots, the herb part of the plant, the stem, the leaves. The digoxin is present in all parts of the plant. Again, it's a defense mechanism for the plant, so it's not eaten. So there's no part that isn't toxic. Symptoms follow the cardiotoxic toxidrome. So your digoxin poisoning symptoms are going to follow that initial nausea, vomiting, abdominal pain, hypotension, hyperkalemia, and then those arrhythmias. However, foxglove has one distinguishing symptom which sets it apart from all other plants, or all other poisonings. Well, really all other poisonings that we're going to talk about today. Its symptoms follow the cardiotoxic toxidrome in addition to xanthopsia. Xanthopsia is yellow vision. So if someone is experiencing digoxin toxicity, whether it's from the actual pill, like digoxin, the actual tablets, or if it's from consuming the plants, they will see a yellowing of their vision. Now, their eyes aren't turning yellow, but they'll see yellow halos around objects within their field of vision. And there is some speculation, and there have been articles written about this, that this man right here, if you didn't recognize him, that's a self-portrait of Vincent van Gogh, might have had some kind of digoxin toxicity from the different plants that he was foraging on this guy who was foraging through the fields of Provence and Belgium and the Netherlands when he was living there. He was quite literally a starving artist. So he was gardening, he was making his own food. But there is a thought that his art style might actually be indicative of a potential case of xanthopsia, because he would often paint halos around things. I mean, Starry Night is a perfect example, right? If you think of his most famous work. So just a nice little side note. So when you think of foxglove, think of those yellow halo xanthopsia and think of Vincent van Gogh, check out some of his paintings because he's the best. One thing with foxglove, we do know how to treat its poisoning. Why? Because we actually have a reversal agent for digoxin on the market. It's digoxin immune fab, otherwise known as digibind or digifab, and it's an antibody reversal agent which binds to the digoxin and renders the toxin inactive. It's extraordinarily expensive, but it is used. And of course, and you'll see this as a theme through many poisonings, you'll also administer activated charcoal if ingestion was recent. Activated charcoal, again, it'll bind to stuff in the stomach and also usually make people throw stuff up as well. As I was saying with mistaken identity, this is how close foxglove looks to literally a plantain plant. Just, I mean, you can see how that can that could potentially be dangerous to gardeners and foragers alike. Next up, we have common oleander, or Nerium oleander. Easy to remember the Latin name when it's part of the common name too, right? So oleander is a woody flowering shrub, which is commonly planted in parks and gardens. And it is highly toxic. It is very, very highly toxic, despite being a very pretty flower. Its toxicity, it contains cardiac glycosides like oleandrin, which function in the same way as other cardiac glycosides like digoxin. It has the same MOA, same mechanism of action and symptoms as digoxin overdose, which follows that cardiotoxic toxidrome. However, you do not have yellow halos with oleander or oleandrin poisoning. Now, oleander tastes very bitter, so accidental poisoning is very, very rare. However, intentional poisoning as part of an attempt to take one's own life is unfortunately not as rare. The sap of the oleander is also incredibly toxic. It's so toxic that it causes contact dermatitis after prolonged exposure to sap. So even if you're trimming oleander in your garden, it's a good best practice to wear gloves so you don't get the sap on your hands. And of course, not to touch your eyes or other parts of your skin because it can cause eye and skin irritation. Treatment, again, it's not perfect, but evidence does suggest that digoxin immune fab or digifab are supportive and effective as well. So the antidote for digoxin, it also works for the antidote for oleandrin and oleander poisoning. And you can kind of see why, because digoxin is shaped very similarly to the oleandrin molecule. Monkshood and wolfsbane, otherwise known as Aconitum species. That SPP right there just denotes that there are multiple species within the genus and that all of them are of the same toxicity. So monkshood or wolfsbane is a herbaceous flowering plant with hood-like flowers. You can see them. They're quite pretty. They are grown in gardens all over the place, and they're used in modern day mysticism as well, in spiritualism as well as pop culture. Of course, wolfsbane is supposed to be that antidote to werewolves and monkshood. It's seen as a historically very holy plant, so it was used to drive off the forces of the occult. Now, however, what it can also drive off is some issues. Toxicity. It contains aconitine and other alkaloids. They are potent sodium channel activators. As little as 1 gram of the plant material can kill an adult by activating sodium channels across the body, including in the heart. The symptoms appear similar to cardiac glycoside poisoning at first. However, they rapidly progress to being much more serious, including muscle weakness and paresthesia, or numbness of the face and skeletal muscles, ventricular tachycardia, or VTAC, respiratory paralysis, and cardiac arrest. So it's a very, very nasty way to go. The treatment is also refractory to cardiac glycoside reversal agents like digibind. So you cannot count on digibind saving a patient who has been poisoned with monkshood or wolfsbane in the same way that it would save a patient who had digoxin or oleandrin poisoning. You can try IV atropine. There are some case studies where that was useful, as well as sodium bicarbonate infusions and inotropic supports. However, it may require temporary life support and cardiopulmonary bypass, because if it does indeed induce respiratory paralysis, the patient is not going to be able to breathe on their own. So it might involve getting set up with an ECMO machine, some other way of bypassing the heart and the lungs until the poison can be completely purged from their system and they're able to breathe on their own and their heart is able to beat on its own again. Next up, we've got our neurotoxic toxidrome. So common offenders here, water hemlock, deadly nightshade, and the devil's trumpet or Jimson weed. I mean, devil's trumpet, you can come up with a better neurotoxic name for a plant, right? The symptoms often initially are abdominal pain, nausea, vomiting, weakness, again, very non-specific. However, this often progresses to confusion or delirium. Neurotoxicity also manifests in the form of seizures and status epilepticus. Status epilepticus is the condition or the way of describing the condition where a patient is having multiple seizures or a seizure which lasts longer than 5 minutes. That could be a symptom within the neurotoxic toxidrome. Sometimes you also have the classic anticholinergic symptoms. So you've probably heard this all the time in pharmacology, but the mad as a hatter, hot as hell, red as a beet, dry as a bone, blind as a bat. You have dry skin, fever, tachycardia, blurred vision, confusion, and agitation, as well as mydriasis or dilated pupils. That is a textbook symptom of the anticholinergic toxidrome, which fits right in with the neurotoxic toxidrome we're talking about. Ultimately, what leads to death with the neurotoxic toxidrome is neuromuscular paralysis and respiratory failure. If you're not able to move your diaphragm muscle and the diaphragm is paralyzed, you're not able to breathe. The general treatment, kind of rough. There's often no specific antidotes. So supportive care is given. There's airway protection, sedation with benzodiazepines, muscle relaxation with neuromuscular blockers to treat these symptoms. For anticholinergic poisoning, however, there is an antidote, and that would be anticholinesterase or physostigmine. So let's start with the mother of all anticholinergic poisons, deadly nightshade or Atropa belladonna. This is probably the most famous of all poisonous plants, and it is a really nasty little plant. You see it has these pretty little purple flowers along with these berries, which can look enticing if you don't know what it actually is. It's an extremely poisonous herbaceous shrub. Contains tropane alkaloids, most notably atropine and scopolamine, which are medications within themselves. Atropine is a topical ophthalmic for dilating pupils. In fact, Atropa belladonna, it used to be used back in the day. Belladonna, it's that got its name from so beautiful woman, bella donna in Italian, right? Women used to put drops of deadly nightshade of Atropa belladonna into their eyes, and it would make their eyes dilate and look more beautiful, right? So even today, we use atropine in that setting. It could be used as well as injections for heart block and bradycardia. And it's actually an antidote for another poisoning, ironically, right? So it's an antidote for organophosphate or pesticide and nerve agent poisoning, which we will get to a little bit later. Deadly nightshade also naturally produces scopolamine, which of course is a motion sickness or post-op nausea and vomiting medication. And it's also administered to decrease saliva for surgery, again, aligning very well with that anticholinergic toxidrome. Every part of the deadly nightshade plant is poisonous, and just a few berries ingested by mouth can kill an adult, let alone a child or someone who might, depending on your height and weight, who might accidentally consume some of these. But the symptoms of the poisoning are classically anticholinergic. So think back to those symptoms that I described earlier, and we do know how to treat it. So you're going to treat it with beta blockers for the tachydysrhythmias, beta blockers for these very, very irregular and fast heart rhythms, benzodiazepines to treat agitation, and physostigmine in severe cases as the anticholinergic reversal agent. This is usually only needed if someone ingests enough deadly nightshade to put them into a coma. Water hemlock or Cicuta maculata. There are other species, but it's this very, very large herb which grows across North America. It grows in swamps, meadows, ponds, other areas where the soil remains damp constantly. So you'll see it in a lot of wetlands, and it does grow around here, unfortunately. It has a very large hollow stem, and it grows up to 6 feet tall. So this is a big, big plant. And it grows umbels, or bunches of white flowers, as you can see right here. It's confused sometimes with parsnips by foragers, because it looks like parsnips are kind of like almost like baby carrots that you can bring out of the ground, and they do have that thick root that kind of looks like a carrot, as you can see down there. Um, and it's known as cow's bane by some farmers because cows will eat it thinking it's a vegetable or something, or they'll just eat the plant in general because cows will wander over and eat whatever. And it often kills the cows so quickly that they barely move from the spot. It's really within a matter of minutes. That's how violently toxic this herb is. It produces cyclotoxin, which is its active constituent, named after, of course, the genus. The mechanism of action is disputed, and it's very, very difficult to research. It's difficult to research for two reasons. The first reason being it often kills things more quickly than you can actually. It kills things so fast that if you were to administer it to a mouse or something like that, you can't really monitor how the toxicity affects the body in any meaningful way. And also, the toxin itself, cyclotoxin itself, does not it degrades almost immediately upon release from the plant. So unless it's been ingested and it goes into your body, they can't really study it outside of the plant, and it doesn't keep well. However, we do know it's a GABA receptor antagonist, and it has potent central nervous system effects, which induce vomiting, convulsions, seizures, coma, and respiratory failure within just a few hours in humans. The treatment is primarily supportive care, and again, activated charcoal within 30 minutes of ingestion to reduce the poison absorption. Devil's trumpet, otherwise known as Jimson weed, Datura metel. It's a shrubby herb with distinct trumpet-like flowers. Again, it's often grown ornamentally, which is why we see this in poisonings, because it's small kids eating it in a garden or something like that, or in a backyard. It's also frequently used in traditional Chinese medicine as part of treatments for asthma and chronic bronchitis. So it may be included in some traditional Chinese medicine formulations as one of maybe 20 different herbs in a single formulation. Now, ordinarily, the TCM practitioners know how to effectively dose this, but again, you don't know necessarily what you're getting if you go out into a marketplace and get something that has Jimson weed content. It's sometimes actually consumed intentionally to experiment with hallucinogenic effects. The reason for this is it was popularized as a main ingredient in Haitian zombie potion as part of another datura species, which was used in traditional voodoo rituals. So you might actually see this growing in and around, say, New Orleans or places with a large Haitian community. Even honey from bees pollinating datura can be poisoned. So even if you have this growing in your garden, the bees down the street that pollinate it might actually create some toxic honey, which is wild to see that it's that toxic. Like I said, very toxic, even in small quantities. It has tropane alkaloids, scopolamine, and atropine, so just like deadly nightshade. All together, make it a very, very potent anticholinergic toxin. Its anticholinergic symptoms also veer into what might make sense for the zombie poison. Amnesia, hallucinations, as well as convulsions, in addition to respiratory depression. Again, we really want to make sure that we maintain the airway and the respiratory system in poisonings of this type. The treatment is anticholinergic treatment. So again, our beta blockers, our benzos, and physostigmine if it's serious enough. Activated charcoal as well to prevent any more of the plant from being absorbed if it's early enough after ingestion. Next up, look at this. We're already 2 out of the 4 toxidromes in, and on to the third. The cytotoxic toxidrome. So the toxidrome, which is acutely toxic to you on a cellular level. These are the nastiest of the poisons. Stone fruits or amygdalin, as well as the castor bean, fall under this cytotoxic toxidrome. The symptoms are often pain and inflammation of the abdomen and GI tract at first, So again, very nonspecific, nausea, vomiting, diarrhea, but eventually this leads to internal hemorrhaging, oftentimes changes in skin color, which you will note in the next two plants, and multiple organ failure and or respiratory arrest. So once the poison starts, it proceeds to rampage through the whole body quite quickly. The general treatment for the cytotoxic plants that we're talking about are supportive care, especially the airway and life support measures. That is the most important thing. And if you can administer an antidote, that is ideal, but that's assuming that an antidote exists. So let's start off. I feel like everyone in pharmacy has probably learned about cyanide at some point, but we never really talk about it or how to manage the cyanide poisoning. So cyanide glycosides are just sugars bonded with another functional group, in this case, the cyanic group. Cyanogenic glycosides are bonded with a cyanohydrin group, which releases the extremely poisonous compound cyanide when crushed or hydrolyzed. So cyanogenic glycosides are not poisonous in themselves. However, when they undergo metabolism within the body, they can turn into cyanide and lead to cyanide poisoning. The beta-glucosidase enzyme is what we have, this little green guy right over here, that can catalyze this conversion into hydrogen cyanide and ultimately lead to some significant cytotoxic problems. Cyanide glycosides naturally occur in plants as a defense to deter herbivores. So again, plants can't run away. So what do? They produce a poison. And they are prevalent in the pits and stone fruits of very, very commonly eaten fruits, such as peaches, cherries, plums, apricots, even in almonds and apple seeds. You might recall your parents telling you not to eat apple seeds. That's why. They do contain compounds which could be converted into cyanide if ingested too many of them. So again, this is how you would generally go about so that is the origin of cyanide within the natural world. This is how the symptoms manifest and how the treatment. The typical presentation of cyanide poisoning is not what you might expect. Even just down to the name. You think cyanide, it sounds like, cyanosis. It sounds like your skin would be turning blue. That is not the case. In fact, your skin turns a cherry red, like a deep, deep red in appearance. You get very, very flushed due to elevated venous oxygen content resulting from the failure of the tissues to extract oxygen. So the way that cyanide poisons you is it prevents your blood cells, it latches on to oxygen within the blood, and it prevents your cells from undergoing cellular respiration, and all of your cells, all of the oxygen rather within your circulatory system has nowhere to go, because it's your veins are starting to carry oxygenated blood because it's not perfusing anywhere else. So people get a red appearance because instead of their veins are turning red like the arteries. It's very, very important to note that with cyanide poisoning, your pulse oximetry will be falsely high and therefore unreliable. This is a hugely important detail, because if someone with cyanide poisoning is struggling to breathe, like they can't catch their breath, their skin is cherry red, you put it on the pulse oximeter, it's going to say they're at like 100%. Well, of course, yeah, their blood is completely oxygenated. That's true. The oxygen is not leaving the blood, though. So that's the issue. It's not perfusing into any of the tissues. It's not perfusing into any of the cells. So yes, their pulse ox is very high, but that doesn't change the fact that they're essentially suffocating. You'll get tachypnea, or rapid shallow breathing, followed by apnea, or just a cessation of breathing. The classic symptom as well of cyanide poisoning, which it only happens in about 40% of patients, but it is a symptom, is the smell of bitter almonds on a person's breath. And that's the smell of that cyanogenic glycoside group being broken down and exhaled after the cyanide has been released. There's often pupil dilation or mydriasis, altered mental status and confusion, and then ultimately convulsions, coma, and respiratory failure. So luckily, we do have a treatment for cyanide poisoning. If cyanide poisoning is strongly suspected, number one, don't wait for labs to administer an antidote via IV. That patient is going to die. You need to administer that antidote now. That antidote is called hydroxycoalbumin or cyanokit, or sodium thiosulfate with sodium nitrate, that is methiodotes. It binds to the cyanide within the person's system and it flushes it out of there. And it's a very, very effective antidote. But again, a person suffering from cyanide poisoning, especially acute cyanide poisoning, they could be dead they could have respiratory failure anytime. So you do not want to wait for labs to come back saying they're positive for cyanide. Giving them the cyanokit, the treatment, will not hurt them if it is not cyanide poisoning. Likewise, you want to make sure that at all times the patient has respiratory and oxygen support, and be prepared to intubate them if in some case they do go into apnea. One of the reasons why you might say, well, outside of a spy thriller or something, when would we encounter cyanide poisoning? There have been some cases, especially related to this specific dietary supplement or herbal remedy as it's marketed, and that is amygdalin. Amygdalin is a cyanide glycoside isolated from almonds in the 1800s, but it's mainly present in peaches and other fruits in the genus Prunus. And it is responsible for laetrile, which is a chemical derivative of amygdalin. Laetrile is often sold by some shady supplement companies. You can see here, God's natural cancer killer. It's sold as a detox and cancer treatment since it's been marketed like that since the 1950s, but it is no more efficacious than placebo in these cases. Again, as I mentioned, laetrile can be metabolized easily into hydrogen cyanide, which blocks cellular respiration and leads you down that route, which I mentioned on this slide. Since the 1950s, it has been the slickest, most sophisticated, and certainly the most remunerative cancer quack promotion in medical history. That's according to one oncologist that I was able to quote online. It was banned for interstate commerce in 1979 by the Supreme Court, but subsequently legalized for sale in several states. And it's still considered a holistic cancer treatment, or vitamin B17, available in other countries. And it's insidious, right? That people would prey on folks who are desperate, who have cancer, who are looking for alternatives, who might have been told by numerous doctors there's nothing more that they can do. And then they try laetrile and they end up in the hospital for something entirely unrelated that was completely preventable. So amygdalin is associated with cyanide poisoning and the cytotoxic toxidrome by, again, inhibiting that cellular respiration. Castor bean, or Ricinus communis. I will confess, this is one of the coolest looking plants that I have ever had the fortune to grow. I love growing my castor beans. They are fast growing deciduous shrubs with distinctive red and purple coloring with seed pods. Seed pods kind of look like they're straight out of Dr. Seuss. And the Latin name, Ricinus communis, actually comes from the word for tick. Ricinus is the word for tick, and it's because of those, the seeds kind of look like ticks. That's what they were named after. The seeds are also crushed to create castor oil, which is a laxative and cosmetic. It's important to realize as well that the castor oil itself is not poisonous whatsoever, because the actual poison, the ricin, which is naturally produced within the castor bean, is not liposoluble. So it's not soluble in oil. Therefore, as the castor oil is created, they extract all of the potential toxins, and you get that laxative and cosmetic, which we know and love. So in terms of toxicity, the castor bean, especially the seeds, but all parts of the plant, are highly poisonous and contain ricin, which is a toxalbumin, or a toxic plant protein. So it's not just a chemical, it is a protein, a very, very complex protein, which actually inactivates a person's ribosomes, their cells' ribosomes. Without ribosomes, we do not have any new protein creation in our cells. And ricin, as used as a nerve agent, oftentimes in military grade, it's a neurotoxin that's, or it's a cytotoxin that's used, the likes of James Bond and spy thrillers, but you could still be poisoned by it today if you did consume the pulp from 5 to 20 seeds. However, the raw seeds are safe to touch. The problem with ricin poisoning, which makes it different from a lot of these other ones where you find the symptoms immediately, you immediately know something is wrong. Oftentimes, you're not going to feel that your ribosomes have been inactivated. You can't feel that as a physical symptom. So what happens at first is just pain and inflammation of the GI tract, which is about 6 to 12 hours after ingestion. That proceeds to vomiting, diarrhea, and hemorrhaging, internal bleeding. And ultimately, shock and multiple organ failure follow, causing death in about 3 to 5 days without treatment. You get multiple organ failure because if no proteins can be produced by these cells, your organs can't function. And again, proteins and toxins will build up in your body. You'll go into shock, sepsis often. It's a very nasty way to go. Treatment for ricin poisoning is symptomatic and supportive. IV fluids and electrolytes, as well as medications for hypotension and seizures. Airway management and assisted ventilation are a must. And it's a long road to recovery because survivors usually have multiple organ damage that they have to contend with. So they will often spend months and months and months in the hospital if indeed they do manage to survive the initial poisoning. On that happy note, let's go to gastrointestinal and hepatotoxic toxidromes. So these are two, they get grouped together kind of. This is kind of the miscellaneous group of different types of plants, but I figured I would do two examples of plants with vastly different mechanisms of action. The common plants we're going to talk about are dumb cane, otherwise known as leopard lily, and groundsel, which I see growing all over the place since I actually made the slideshow. The symptoms are oropharyngeal irritation sometimes, pain and swelling, upper GI bleeding, right upper quadrant pain and ascites, that has to do with your liver, right? Jaundice, again, a symptom of hepatotoxicity, and acute liver illness, hepatitis, or others. The general treatment, again, for these is supportive or symptomatic care. So, dumb cane or leopard lily, which is a Dieffenbachia species, multiple different types of Dieffenbachia, and they're a large, large genus. So there's 200 something in this species of large flowering plants native to tropical climates, and they're regularly used to indoor houseplants. Like, I'm sure this looks like your mom or grandma's houseplants that you've seen a million times, or you've seen for sale in stores all the time. They're not toxic to touch, but dumb cane and leopard lilies, Dieffenbachia species in general, they have a natural production of calcium oxalate crystals occurring within the leaves. So that's the same material as about 75% of kidney stones. And if you've ever had a kidney stone, you can imagine how painful that might be. So these natural rhaphides, or microscopic needles, are present within the leaves of this plant. So if a poor little kid bites into one of these leaves because they're just curious and they're just being a little toddler, orally, they're going to have these crystals get embedded into their mouth and tongue, and they're microscopic. You just have to wait for them to fall out. This is lethal to certain animals. It's just painful to humans if the leaves are chewed and swallowed. So the symptoms of this poisoning or toxicity, or reason to call poison control, are oral and pharyngeal pain, numbness, and irritation, excess salivation and swelling, and these symptoms may last from days to weeks. It is until those microscopic little rhaphides fall out. So the treatment is often just oral analgesics, so lidocaine, oral rinses, thinking like magic mouthwash, that sort of thing, as well as antihistamines to deal with any allergic reaction or swelling. Groundsel. Some people might actually mistake this for dandelion, but it grows much taller than a dandelion ever would. Senecio vulgaris, it is a herbaceous weed that is native to temperate climates and introduced to temperate climates worldwide. There's a ton actually growing in the medicinal garden right now that just needs to be weeded if you want to go down and you're on campus for whatever reason and want to see it. It grows to about 16 inches tall with small yellow flowers. I've seen them grow much taller than that, but their yellow flowers are quite easy to tell because they're almost fully encased. They have this very, very the sepals are very, very long, and they're almost entirely encased in this little green leaf that surrounds them. And then they kind of look like dandelions because they once the flowers are fertilized and expire, it spreads its seeds in the same way that a dandelion does. So you could blow on a groundsel and make a wish, I guess. Historically, they have a history of folk medicinal use, and are still used by some herbalists today, although it's increasingly uncommon. Its toxicity is due to pyrrolidazine alkaloids, including its namesake senecylamine. I'll try to say that 5 times fast, which are highly hepatotoxic or highly toxic to the liver. It's made toxic in metabolism in the liver. So it's actually not toxic until it gets to the liver, and then it gets metabolized into those toxins. The symptoms include right upper quadrant pain, which is a classic symptom of liver toxicity, ascites, and jaundice. And it may induce hepatic veno-occlusive disease, or VOD, which is a life-threatening condition where the small vessels in the liver are blocked. So that might even lead to someone requiring a liver transplant if they do indeed ingest groundsel, whether they think it's a dandelion and they put it in a salad, or you ingest some of the roots. It could be potentially cause life-altering injuries. There's no antidote, only supportive care for symptoms. And then, of course, if you do have that hepatotoxicity and liver injury, you might have to think about having a potential change in your home medication dosing to adjust for hepatic injury and hepatic regeneration. So it's not just going to affect your liver, it's also going to affect maybe all of the other drugs that you're taking if there's a certain hepatic clearance that you need to take any number of your different medications. I'd like to point this out as well. Who regulates the supplement industry? People say that the supplement industry isn't regulated, and that is simply not true. The United States Food and Drug Administration, or FDA, regulates the supplement industry, and it expressly prohibits the adulteration and misbranding of dietary supplements and natural products. The FDA is responsible for taking action against adulterated or misbranded products once they reach the market. That can include anything from just sending a strongly worded warning letter or warning letters out to consumers to not consume a specific natural product. They can issue recalls. They can pursue legal action against certain companies which are selling problematic dietary supplements, or maybe dietary supplements which claim that they can cure cancer, like amygdalin, which we mentioned earlier. The FDA can even go so far as to have FDA agents walk into the pharmacy and seize products right off of the shelf that they deem that to be in desperate need of recall, in an urgent recall. And I should mention too, who regulates the supplement industry? Yes, it is regulated by the FDA. We have roughly 50,000 plus, maybe 60,000 plus at this point, individual dietary supplements that are sold on the market, and roughly 5,000 that are introduced to the market every single year. To review all of those, there's a team of 25 people at the FDA. 25. They are woefully understaffed, and they can really only deal with the most egregious cases of violations of drug standards and laws. So, in total, does the FDA regulate the supplement industry? Yes. Does the FDA regulate the supplement industry well? There leaves some things to be desired, but it's really not their fault. Anyway, dietary supplements fall in this area of health promotion, which is somewhere between the spectrum of a food to a drug. So a food provides basic nutrition to someone, right? It provides those primary metabolites. A drug, on the other hand, is meant to cure, treat, or mitigate disease. The dietary supplement falls in the in-between on this spectrum, as do natural products, these secondary metabolites, which provide a benefit beyond basic nutrition and work towards the field of health promotion. So food is regulated differently. Drugs are regulated differently by the FDA. They're much more stringent. Food is a bit more lax. Dietary supplements fall somewhere in the middle. We get significant FDA warnings. Comfrey is a good instance of this. It contains pyridazine alkaloids, much like the groundsel does that I was mentioning. Comfrey or Symphytum officinale, used for a variety of skin conditions and ulcers and arthritis. However, it was found it needed a warning against internal use in 2001. Now products are now labeled as external use only due to that risk for hepatotoxicity. However, there are still occasional instances of comfrey poisoning among foraging, salad greens, because again, it looks like it could go in a salad, or indeed in dietary supplements, which unlawfully and slip through the gaps include comfrey, usually in detox supplements. Kava or Piper methysticum is also widely known and widely condemned by the FDA for its hepatotoxic risk. However, it is a cultural juggernaut within the Pacific Island and Polynesian culture. If you ever go to Hawaii, I highly recommend going to a kava ceremony. Although there is a hepatotoxic risk that is associated with supplements which are very, very highly concentrated, drinking regular kava juice in Hawaii is not going to send you into liver failure if it is properly prepared. However, warnings are continually issued by the FDA. And indeed, you can look up on the FDA's website the dietary supplement ingredient advisory list. There's many reasons as well for adulteration. So when we talk about supplements, we also have to recognize that sometimes they are adulterated with various poison or toxic things. And that might be due to three different types of adulteration: economically motivated, mistaken identity, and inadequate quality control practices. So firstly, economically motivated adulteration. Maybe you have a poor harvest of one herbal product. So instead, the suppliers or manufacturers just substitute the product with something cheaper and more widely available, which the consumer may or may not be allergic to, firstly, if they think they're getting a plant and they're in fact getting a different plant in their supplement. And it may have toxins which the manufacturer is completely unaware of, and yet it remains adulterated because it's more profitable. We have very rare and sometimes tragic cases of mistaken identity. There's an infamous case from Belgium where in 1993 there were mistakes made during the harvesting of Astracolia Australachia fanchi, which is a vine right here in the top right-hand corner. It's actively used in traditional Chinese medicine for weight loss, and it was marketed in Europe as a weight loss supplement with Stephania tetrandra. It got mixed up with Stephania tetrandra, which is on the bottom right, so top right and bottom right. You can see how these two vines could get confused with each other, especially since they grow right next to each other in the same area of the world in China. The toxin in S. tetandra sent about 105 Belgian patients into kidney failure, with many of them requiring dialysis. And thank goodness that the Belgians caught on really quickly and pulled the contaminated lot from the market before it got much, much worse. But these things can happen where plants are just mistaken for one another, sometimes with deadly consequences. And then, of course, we can also have inadequate quality control practices or negligence. And that can be due to a combination of the economic or mistaken identity factors that I already mentioned, and then non-compliance with current good manufacturing practices. So if I like to point out when people are buying dietary supplements or any sort of herbal supplement, always look for USP on the label. That means it's been independently verified and the manufacturing facilities have been certified by the United States Pharmacopoeia, or the USP. That means it's essentially a guarantee that barring some sort of accident, you are getting exactly what you pay for in a supplement. I also wanted to make mention of this one last hot topic in potential toxicity, which is kratom or kratom, Mitragyna speciosa. So kratom or kratom, people tomato, it's a tree native to the tropical jungles in Southeast Asia, and it's used in traditional East Asian medicine for both stimulant and analgesic effects at different doses. So it comes in multiple dosage forms. The leaves are crushed, and then they're made into teas, tinctures, capsules, etc. It's legal then in the US, but it's also labeled a drug of concern by the DEA, and individual states are starting to ban it. So they're sort of catching on to it. Why are we banning it? Why are we having problems with it? Well, the pharmacological properties, there's two main pharmacological components in kratom that we have studied that are the most potent phytochemicals, and that is mitragynine and 7-HMG. Both of these bind to mu-opioid receptors within the body, and patients self-medicate using kratom in place of their preferred substance that they would be otherwise consuming as part of opioid use disorder, or OUD. This becomes a problem because they're essentially using kratom they're using it in the same way that a patient would use Suboxone in order to defer these cravings. However, there's an addiction risk that is inherent to kratom, which causes both psychological and physical dependence. We know there are uncertain clinical effects, but it crosses the blood-brain barrier quite easily and interacts with multiple receptors, including your dopamine receptors, adrenergic receptors, and your 5-HT or serotonin receptors within the brain. So it is hitting, if it's doing a whole game of whack-a-mole in the brain in terms of all these different receptors that it's bouncing off and stimulating. So of course, there's a large risk for drug interactions with people who are taking kratom. Side effects include agitation, psychosis, depression, and more. You could have physical withdrawal symptoms, just like the classic opioid physical withdrawal symptoms, if you were to stop taking kratom after taking it chronically for a long period of time. And there's a huge variation between the product, the dosing, and the quality of the kratom. So because it's not regulated in the same way as a drug, it doesn't have to follow current good manufacturing practices, for instance. Many kratom companies, you can simply click a box saying that you are over 21, and they will ship you a bag of kratom with no directions, no questions asked, for a very reasonable sum of money. This is a very difficult area to regulate within the federal, and it's a question for the FDA and the Federal Trade Commission to see exactly what they want to do to combat this. But like with anything, the same rules apply. The same rules as apply to your vitamin D supplements also apply to your kratom supplements, unfortunately. Even though in many ways this is a medical prescription grade type of plant and product, which is really, really exploding on the market lately. Now, some people swear by it because it does help them get off of, to help them with their opioid use disorder. But we would generally recommend the use of actually prescription medication as opposed to someone just sort of winging it with their own purchased dietary supplement. So, what are our takeaway considerations? Poisonous plants are everywhere, even in your own home. Plants are incredibly varied in their toxicities, so grouping by toxidrome might help save time as well as the patient. Definitely learn your Latin names, because those are the ones that will be on the supplement bottles regardless of language. And also, I know that this is an online distance course, but stop and smell the roses. Take some time after you watch this, go outside, think about those plants all around you. Depending on what time of year you're watching this, maybe it's a beautiful summer day, beautiful spring day, winter or fall. Take a look around the natural world and you might just be a little bit surprised at what you see. So thank you so much. Feel free to reach out with any of your questions, and it has been a pleasure telling you all about these fun poisonous plants.